Okay, now we're going to be talking about the nursing process. So welcome back. So as always, when we begin a new concept and a new disorder, I like you to consider um, uh, self-reflect on how you, any biases you may have or assumptions you may have about substance abusers or substance people diagnosed with substance use. Okay. So there are various assessment tools to determine the extent of the problem that your client has with substance. Um, Doing a thorough drug history and assessment. There's scales that are available for you. The Clinical Institute Withdrawal Assessment of Alcohol scales in your book. The Michigan Alcoholism Screening Test, known as the MAST, is also in your book. The CAGE questionnaire is a resource that I prefer, and I'm going to talk a little bit more about it. So what is the CAGE questionnaire? You ask 4 questions. So I find that to be easier for nurses. These multi-question questionnaires are important, but I like this as a screening questionnaire, I think. So the C stands for have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? Have you ever had a drink first thing in the morning to steady your nerves, also known as an eye opener? So that's the CAGE questionnaire. I feel is an excellent screening tool. So you can have a substance use disorder and a mental health diagnosis. All right, such as you can have schizophrenia and a substance use disorder, such as alcohol or marijuana, heroin. So that's what we call dual diagnosis co-occurring, a substance use disorder and a mental health diagnosis such as schizophrenia. Programs combine special therapies that target both problems, and as you're aware, you've been looking at charts now in the practicum setting, and you've seen patients with dual diagnosis, co-occurring diagnoses. And I tell you, pick one for your concept map. There are dual programs and a lot of the same interventions that we use for your mental health recovery also can be great resources for your substance disorder. What do we want for our patients? So ineffective denial related to a weak, underdeveloped ego. Sometimes, related to or difficult for us to really pinpoint, but your textbook and also the concept map book that your instructors have at the practicum setting help you kind of figure out the related to. And what's our outcome? The client will demonstrate acceptance of responsibility for their own behavior, acknowledge association between personal problems and use of substance. So that's, the gentleman I was referring to was talking to me about his alcohol use disorder and how his employer requested that he drank before he comes to work because he's a better painter. That could be true, but also it's denying his problem. He's told me, I've been in AA before. I just like substance use. And so it's a personal journey. Recovery from substance use disorders, individualized. And as nurses, we provide the resources and the encouragement and put it in making a wellness plan for recovery. Ineffective coping. Related to inadequate coping skills and a weak ego. Poor self-esteem is something that comes to mind. Poor self-image, guilt, hopelessness, helplessness. These are words that we hear in the psychiatric setting. And outcome for ineffective coping, that client will be able to demonstrate more adaptive coping mechanisms that can be used in stressful situations instead of taking the substance. We also have impaired nutrition, less than body requirement, and fluid deficits related to drinking or taking drugs instead of eating food. And then we will help them identify signs of malnutrition and dehydration and risk for infection because of the multi-organ involvement with substance uses, and that impairs their immune system. So we need to be aware of that, and chronic low self-esteem related to a weak ego, lack of positive feedback. I'm all about providing positive feedback to our patients because their self-worth is so impacted. They feel like failures. You'll hear that. I feel so guilty. I'm a failure. I just can't stop. But once the client is able to decide and state the substance is stronger than I am, and I'm going to say that 3 times because I want you to understand this is not a power of the will. This is an addiction of the brain. So you have to make a decision that this substance is stronger than you. This substance is stronger than I am. When they say that, I have my positive outcome for their recovery because they've realized that if I was just, if they say stuff like, oh, I just have to use willpower, please don't pick that on the test. That's not right. They need to realize that they have no power over that substance, and that's why they need to be in recovery. They need to get support because many times they regress and go into substance use. And that's where they feel guilty about themselves because if I was a stronger person, I'd be able to combat this. No, this is an addiction. You need abstinence. Some people say, oh, if I can have a drink every once in a while. Well, not for alcohol disorders, addiction disorders. You can't. It's abstinence. And that's what these treatment options that we're going to be talking about on our next portion are so important. Knowledge deficit. Here we go. They don't understand the impact their substance use has on their body, and they have to be abstaining from these illicit drugs. It's a depressant. These medications are a depressant when they're intoxicated. They're a risk for injury. Sometimes if you're a mental behavioral health tech, you sit with one-to-one patients who are going through substance use withdrawal because they're agitated and they're confused and they're disoriented and they're trying to climb out of their bed. Their gait is unsteady. So you may have had an opportunity to be one-to-one with this patient, and then sometimes in their hopelessness and helplessness they don't want to live anymore, and we've heard that in the mental health setting many times. We had a gentleman the other day had substance use disorder, talk about how he had to make sure all the guns were removed from his house before he went home because he didn't want to live anymore and that he needed help. There was another instance where 2 gentlemen who had been members of AA and had stopped using that as in their recovery plan, and they regressed back into using. So that's what we need to encourage in our patients. And providing substitution therapy, just like with opioid withdrawal, we use methadone. You'll hear that in report. I've even seen in some hospitals, not Bon Secours, but when I worked with Centera, they would give patients, there was beer in the Pyxis, they could have a can a day just to help minimize the withdrawal. And we use phenobarbital at Bon Secours to help with withdrawal. And we want to promote wellness, education, having them understand the phenomena of dependency, and AA, encourage continued participant in long treatment. AA, very important, very important. Outpatient. And also educating the family and the patient on the effects of the substance in their body and management of stress. using relaxation techniques, deep breathing. Many of your therapeutic groups are related to increasing self-worth. We're thinking about ways to promote wellness, whatever it looks like for you. Problem-solving skills, nutritional. We had nutritional bingo the other day. I love that. This is one of my favorite groups I've had. But it was so important for them to understand nutritional side. And then, getting them the support that they need. Legal assistance, financial assistance, show them, resources like Alcohol Anonymous, point them in the right direction. And then we evaluate, how do we know if our patient's getting better? If they have verbalized that the substance is stronger than them, their prognosis has a better outcome. All right, so we're going to stop here, and we're going to have one more session on this, part 3, and I will see you soon.